Okay.
Okay. Good morning, everybody. Welcome to the June 23rd staff meeting of the Sedgwick County Commission. With that, I'll hand it over to Manager
Good
Tom
morning,
Stoltz.
Chairman. Thank you, and Commission, good morning. Two items for staff today. Glenda Martins is here from Corrections to talk about an advisory board appointment that she would like to make, and we're just following through with the policy of her. She has more than one applicant for a single position, so it's your time to hear from her and to give her some guidance. And then a second item is just our weekly COVID update, which will include Adrian with some numbers updates and Tim with some testing updates. And that's all we have for that. So Glenda, if you'd start us off, please, ma'am.
Okay. Good morning, everyone. It's nice to see everybody.
Hi, Glenda.
It's been about 3 months since I've even been in this room, so it's nice to be back and to be able to talk to you about the Community Corrections Advisory Board. So on that board right now, I have one pending appointment that needs to be made. I have handouts for you, and I wasn't sure how those got handed out. What the new process that I have is the applicants fill out an application to be on the board, and then I take the time and interview each one of them. Right now, I only have 2 applicants. One is an already existing board member. His name is Mark Orr. He has been on the appointment since 2018 of March. He is the deputy public defender, and he does a great job on the board. His attendance is very good. He adds a great perspective to the board because he is defense counsel. We enjoy having Mark on the board, and it's his reappointment that's come due. I also had another applicant. His name is Richard Vargas, and you might recognize him. Richard is an interpreter here at the courthouse. Enjoyed getting to meet him. He's very dedicated to the work he does. He would be an excellent board member as well. He would really like to help and advise about rehabilitation. And of course, he's worked with the criminal justice clients for a long time as an interpreter. My recommendation would be to just reappoint Mark Orr for the position. He's done a great job. This will just be his second term, and I would like to see him come back. So.
Okay. Well, thanks for the background, and it's helpful to know on these board appointments, the director of the program's recommendation is helpful for at least for me, and I think the others. So I noticed that you've got just a small handful that are coming due in 21. First one March and a couple in June, so
right.
I'm glad you have these all spaced accordingly. That's, I assume, by design.
Well, I will tell you that this process is, I think, very good. I'm going to have coming up very shortly the Juvenile Corrections Advisory Board,
Okay.
and I will have 3 vacant appointments for that I'm going to need to fill, and I have 11 applicants. So I am spending this week to interview those. And so it does open the door to who else is interested, and it's been a very good process. So that will take maybe a little bit longer to go through. But right now, today, we just have this one vacant position that we need to fill on the adult side.
Okay. Commissioner Cruz has a question.
Thank you, Chairman. So going back to the juvenile board that you have, is the application process closed, or would you still accept applications?
We actually closed it on the 12th, but since I hadn't interviewed, we went ahead and let the last one that applied yesterday interview as well.
Okay.
So we're trying to keep it open to anyone as much as possible, but when I start interviewing, then it just becomes not fair if the process is already closed.
Yeah.
So,
Okay.
But we do have 11 applicants, and that's the most I've ever seen. So.
Nice. Good. Thank you.
Okay, I don't see any other questions, so
Nope,
good to
thank
see
you.
you.
Good to
Welcome
see
back.
you.
All right. Next up,
Adrian?
good morning, Adrian.
Good morning, Commissioners and Board of Health. Adrian Burns, Sedgwick County Health Director. So Kansas has 12,465 cases of COVID-19, and Sedgwick County has a total of 896. We have had a total of 595 people that who have recovered, and 25 people have died so far. I wanted to review our recovery matrix, and the main three things that we're focusing on, which is the same thing that the state of Kansas focuses on, are the amount of deaths, new COVID hospital admissions, and cases per 100,000 residents. And our testing has been consistent since about the second week in May, so for a good 4 or 5 weeks now. And our cases have been increasing in our community in the last 3 weeks. Dr. Min stated last week that it was going to be quite some time before vaccine was developed. And we do have limited tools in our toolbox, but there are some that we have. And one of those are travel restrictions to those states that have high rates of COVID-19. And anyone that travels to those states, they're on the CDC website and KDHE and our website, need to quarantine when they return from visiting for 14 days. We have the ability to screen and test people in Sedgwick County and at our own drive-through, our drive-through at 2716, and anyone can be tested. They just have to call 211, and then 211 will connect them with our nurse triage, where we will then schedule them for an appointment, and that's whether they have symptoms or not. So we have our preventive measures that we've been talking about since the beginning, and that's a social or physical distancing of 6 feet, and washing the hands really thoroughly, not touching the eyes, nose, or mouth, coughing into a tissue or elbow, and particularly wearing a mask when you can't be more than 6 feet away from someone. So in order to get on top of our numbers and get that trend going in a different direction, it's going to be really important that people remember, even though everyone's been in a hurry, naturally all of us have, I have, to get out and do things and get some semblance of normalcy. The COVID-19 is still in our community, and it's going to be in our community, and so it's really important to put those masks on and keep the distancing wherever we are. And that's my report.
Okay, I have a quick question, Adrian. So we're now at a point, it seems like where some businesses are many are paying attention to what they should be doing as far as guidelines and best practices, and others are being lax about it, so to speak. But those that I think some of us are starting to get questions about, where do they call, or what do they do to find the right guidelines for the business I'm in? And of course, we can reference them to our website or the state's website for the guidelines. But then are we staffed enough to where we can hand them to a physical person on your staff to where you can walk them through the best practices?
If someone has a question, they can definitely reach out to me, and several businesses have.
Yes.
And there have been businesses that have chosen to close in our community, and it was not by guidance of the health department. It was by them just being extra cautious.
Right.
We don't expect businesses or schools to close with just one case. I mean, sometimes one case could be enough, depending upon the number of contacts and if it's contained. But other times, one case will be contained with a number of contacts, and it wouldn't be necessary for them to close. So we're really stressing to businesses to, when we call them about someone being positive, to please get with us if they have any questions on closing, and we will definitely guide them through that.
We're talking temporarily closing, not closing
Yes.
for good. So I think we should make that
Yes.
distinction in our
Absolutely.
community, because some folks are concerned that people are shutting down permanently, and I think we should all start using the term temporarily closing.
Yes. Yes, there are some that have temporarily closed just to do an extra cleaning. And then another couple businesses I'm reading that are just choosing to step back and wait to see how things go. But the ones that have cases are temporarily closing just so they can really feel good about opening up and doing all the sanitizing that they need to do.
Okay. Any other questions? I don't see any, so thanks
Thank
again
you.
for the report, Adrian. Thanks to you and your staff for what you do.
Good morning, Commissioners. Tim Kaufman, Deputy
Morning,
County
Tim.
Manager. I wanted to talk a little bit about the testing, give you another testing update. Last week, we tested a total of 962 individuals. 826 came through our drive-through testing on West Central. We had 52 that were tested by the containment unit where they went out and tested. And then we had 84 that were tested at our our mobile testing site in Mulvane. We tested 84 folks there. So again, 962 folks, roughly 50% asymptomatic and 50% symptomatic. So we've seen a good response from the community, folks that are interested in being testing even without symptoms. Again, we encourage anyone to call 211 and we can get them scheduled for that. Or if our mobile testing is going to be in their community, they can call 211, get an appointment, or they can just show up and get tested, and they don't need to have symptoms for either one of those testing opportunities. We have not had the level of response that we had hoped for with our randomized testing sample. We have, the call center on our behalf has made about 4,000 calls. The thing that's kind of interesting to me as we've looked at the numbers is that we've made contact with about 55% of the folks that we've called. So we've either got them to answer the phone initially or they've called back. We've left a number and a message and they've called back. Of that group, we've only had about 14% say, yeah, I'd like to participate in this test. And so the message that we've gotten out asking people to help us understand the disease in the community has not resonated very well for whatever reason. And then the other interesting thing is that of the folks that we get scheduled to come in for a test, about 2/3 are showing up. And with our folks that go through the 211 testing, about 80% of those folks that schedule show up. So we have a higher show rate as well. So for whatever reason, we haven't had the level of response that we had hoped for in getting that randomized sample. And so we will continue to push that this week and see what we get, and then we're going to have to really assess whether or not that's the right model. It may be that in this day and age, a telephone scheduling system doesn't work, and we'll have to assess that. By the end of the week, we're still optimistic that we'll get some more data, but I'm encouraged by that. We had almost 1,000 folks test, including those folks in the randomized sample, but we're just not getting the level of response that we had hoped for with our we mailed everybody a postcard and then we followed up with that phone call, and we just haven't had the kind of response that we had hoped for. So we will continue to operate that. We'll have that call center make those calls the rest of this week and see if we can't get the numbers up a little bit. But we'll still continue to test at the drive-through center and the mobile test site. We have a mobile site going live this Thursday in Valley Center, and then we'll be in Colwich again next week. So we'll continue to do that. And we have seen a really nice response of folks who don't have symptoms. For whatever reason, that there are people out there that are interested in getting tested, and so we're getting them scheduled through our 211 system, and we'll continue to do that.
Okay. Commissioner Cruz?
Thank you, Chairman. Out of those 962 people, can you refresh my memory where we're sending our tests to?
I can. If they are individuals with symptoms, we're going to send those tests to the Cahill, the KDHE lab, and have them have processed there. If they are going through our community testing, so calling 211, we're sending them to a private lab. And if they are part of that randomized sample, we send them to a different private lab. And
And so the turnaround time for Cahill is what?
Right now, it's back down to about 48 hours, roughly. It has extended as long as 5 to 7 days, depending on what they've got going on.
And the Community 211 private lab is what name?
That's Quest.
Okay, and what's their turnaround time?
It's about 2 to 3 days generally.
And the private hill, the Quest lab, is that here locally?
They are sent out of state to be processed.
Okay, what state is that sent to?
California.
Okay, so we're paying courier fees for that?
Well, it's embedded in the price.
Okay. And then the other randomized testing, where is that private lab? What's the name of it?
It's a lab called Sinochips. It's attached to the KU school, the med school in Kansas City.
Okay. What, I'm sorry, what, Cytochips? What?
Sinochip.
Sino? Okay. So we have, and what was their turnaround time?
About the same.
2 to 3 days?
Mhm.
So yesterday, I had a conversation with somebody about saliva-based testing that could be collected at home in a collection module. And I know that I just gave you that information yesterday. But I wondered if you'd had any time to check into that, or what is the status of your research on that?
We still need to find some more information out, but that's one of those samples right now that it looks like it doesn't have full approval. It does have FDA, EUA, which is experimental use approval. So it doesn't have the same level of approval as the test that we're using right now, but it is a similar type test. It's testing for that DNA. We're continuing to do some research. There are some models that would appear to have a faster turnaround, but we're continuing to do research on that.
Okay, so so you're going to check into the validity of the test, and then what? Okay, and so we're talking about validity, we're talking about turnaround, and we're talking about cost. Are there other factors that we're taking into this? I mean, with the saliva-based, you can do it at home with a collection module. We're talking about spending a bunch of money to move our testing site from its current location to a different location because of heat, full PPE with our healthcare workers. So I just want to make sure we're factoring in all of these things.
As you had asked, we'll look at the costs,
Okay.
The full cost, absolutely.
And the only other thing I'd throw into that list is availability the availability of the commodity to acquire.
Supplies, okay.
Those are the things we all have to look at. And I'll just mention also, whenever Tim talks about any testing going to any entity other than the KDHE lab, there is a cost associated with that. So we're not paying to send samples to KDHE on the symptomatic patients, but for all of these there is a cost to send to the external labs, just for your information.
And I will tell you that I had talked to the lab manager at KDHE probably 4 or 5 weeks ago when the Abbott test came, the rapid Abbott test came out, and talked to them about the viability of maybe, we have a CLIA certified lab here, and talked to him about the advisability and the viability of maybe getting one of those machines and adding that to our milieu of things that we do in our lab. And at that point in time, his recommendation was that we wait, again, because it takes if everything works just perfectly, we may have been able to set up a lab or set up that testing machine and get it going and
The testing machine, meaning the Roche 6800?
Or the Abbott, either one of those two. They do very similar work.
Now, I heard the Abbott test is not very good.
Correct. That's what we're seeing now, and that was part of the recommendation that we heard at that point in time too. And so we've looked at it in the past. We'll continue to look at it. And, you know, as we've talked a number of times, Adrian talks about COVID time, and COVID time is a little bit different than real time that we've experienced in the past. And so things are changing pretty rapidly. So we continue to look at alternatives, and we'll fully check out this Roche opportunity as well.
So my last and final question is, are there no laboratories in Kansas that we could send our Community 211 I mean, if we're shipping these out to California, I mean, there's other laboratories in Kansas. Have we explored those before we ship these all the way to California?
We have talked to multiple lab companies, and I think the reason that we chose Quest was they were able to handle the volume, they were ready to handle the volume that we needed at that time. Since then, we became made aware of the Sinochips lab up in the Kansas City area, and so that's why we've added them as another alternative if we get to a situation where one of the local options or the Quest option doesn't work for us.
So the other lab that I sent you was Cytocheck Laboratory in Labette County, so I'd like to check out them as well.
We'll do that.
Thank you.
Commissioner Howell?
Mr. Chairman, just a follow-up question on that. When someone says that
There you go.
thank you. Follow-up question. When someone says that the rapid response test is not very good, can you quantify or qualify what we mean by that? What do we mean by that?
Generally, what they're talking about is the reliability of the results on the test.
Is
And
there like false positives and false negatives?
That's what they've been finding. That's what they were finding early on. It's entirely possible that that has improved over the last 5 or 6 weeks, but that was what the results were indicating in the past.
Do we have? I guess I'd like to get those numbers if we can. I can go search for that myself, but if you have them, that'd be great to get that. I'll probably have some other questions, but I'll stand by. Thank you.
Tim, I have a question about, so our original goal of 1,600 random testing, that was to try to get a overall, a clear statistical random sampling of our 500,000 population, age, location, all those things. So since that's struggling with confirmation, I'm just wondering, we had a heat map before of cases, at least positive cases. Is there, I'm not asking for additional workload, but I think the public might be interested if we could plot at least what we've done. If we don't end up, if we need to get 1,600 people to have a true random sampling and we don't get 1,600, then.
Doing a heat map on testing?
Yeah, I think if we can, I think it'd be helpful.
Sure, yeah, we can absolutely do that.
Knowing that and I realize the mobile unit will have neighborhood areas that are
Sure.
hot spotter than most, but I think it'd just be
The other
helpful.
interesting dynamic with the asymptomatic testing is we were having this discussion just a few minutes ago. That could be, not could be, there are a number of people who are coming through multiple times. And some of them are very legitimate. For example, nursing home workers, for example, want to come in and be tested every few days, potentially, depending on exposure. First responders, hospital workers, and then just some people, just in their nature, are wanting to be tested for COVID. So if you do 1,000 asymptomatic tests, that's not 1,000 people, potentially. It's a few hundred people, some of them coming in over and over. So we have to figure out a way graphically and analytically to show that, to not put out information that is could be misinterpreted.
Yeah.
So we will work on the heat maps, but remembering that some of those dark colors in there could be a single person getting tested 3 times in a zip code. So.
Okay, and thank you. I see, Kate, you've pulled up a map. I don't know, Tony, if you can get that for the public to view, if we can hold that for a few seconds. The darker is the more intense?
Yes, testing rate per 10,000 residents. The dark color, so here, 500 and above, 300 to 500 is this medium shade of blue, and then 200 to 300 is this light shade of blue. And then the white is 100, or the light gray, light blue is 99 and below. Medium, like that, is going to be 100 to 200.
Okay.
So some of this, I think, is going to be related to nursing homes, for example. We've got
Correct.
some nursing homes down south, so we've gone into those homes and tested multiple folks in those locations, but
And the brown means, what's that, or the tan, is that like unavailable?
unreliable, so it's a really low number.
So if you're testing in Cheney Lake, that's unreliable?
That is
I see.
correct.
Okay. All right. Well, that's helpful. So Tom, I guess we don't have to, you have that. And thank you, Kate, so this is updated daily from Adrian's information? Good. Thank you. Okay.
And this is all tests from anybody who's doing testing in our community.
Correct.
Not just health department.
Right.
Okay. Commissioner O'Donnell.
Thank you. And Tim, I know I'm beating a dead horse with this, and I talked to Tanya yesterday, but I've continued to have people ask about getting daily reports posted on our website about how many individuals are at HCA hospitals, how many are at Ascension hospitals on a day-to-day basis. There was the article in the paper that was at best misleading over the weekend about how many people are in the hospitals. Would you like to address that, or is that something we need Adrian to talk about?
Well, I can talk about it, and Tom can talk about it. We've had a number of conversations with the hospitals about that information, and I think one of the things that is really helpful, if I can navigate to it, right there. So there's a conversation with the hospitals on a weekly basis about whether or not the hospitals are, what kind of condition they're in. Tom gets analytical data, then he does a qualitative assessment, and he determines through that conversation with those folks that hospital status is good. That's not quite what I think the reporter tried to infer from some other data that may not have been 100% accurate in his inferment, but right now, we don't have the data that you just asked for about a daily count from hospitals. We don't get that information from hospitals. Tom made a request again, and I don't know if he wants to talk about how that's going.
Well, a couple things. First of all, the article on Sunday was problematic because we have, I don't know if we've talked to the reporter yet or not. We're trying to determine what he was trying to say, but if you just do cumulative hospital admissions over time, well, naturally, we're going to be higher than ever because it's just like the positive test. We're up to 896 now. That's higher than we've ever been because they just keep adding up every day. So we don't know if he was interpreting it that way or trying to determine what this graph is all about. The graph is just trying to give a general overview of what's going on in the hospitals regarding admissions and releases. Back to Tim's, or the Commissioner, to your statement, we have three major hospitals in this city, in this county, Wesley, Via Christi, and the VA. The VA, most people can't go to the VA, so we never really include them, but Ascension and HCA are our two main providers. So we've had numerous discussions with them, and Commissioner Howell's asked for this for probably 2 months now on an exact number on a daily basis, exactly what you're asking for again today. I had conversation with both of the hospitals yesterday. Via Christi now is willing to feed into a database, but I have yet to hear from Wesley. And if we can't get both of them, the data would not be where you want it to be. So I'm going to try to reach out to Wesley again today, because this relationship is not going to end in the next week or two. This is going to be for the whole year, at least, the rest of 2020 and probably into 2021. So this is it's a long-term relationship now that we have to try to manage. So I think we're going to continue to try to get to where you want to get. And hopefully, I don't know if, although Via Christi has offered to provide information daily, we try to get the other major provider there. So we'll continue to work and negotiate that.
Okay. So, Mr. Chair, if I may follow up. So, first, does Johnson County, do their hospitals provide that? Because that is what I've continued to hear. Can anybody confirm that Johnson County gets daily updates from their hospitals?
They do.
Okay.
It would appear that they do.
Right. That's what I understand too, but I just
Well, at least they have something on their website, which appears they do. We're trying to validate that and going back and asking.
And I'd rather have no information than bad information. So if Johnson County's is not correct, it'd be better not to have any information than erroneous information. So I think we all can agree with that. But this, yes, Tim?
When I looked at it, I believe that it was a weekly rather than a daily count, but we'll have to go back and check
Okay,
again.
yeah, that'd be great. And we're meeting, you know, we'll have another staff meeting next week where we can talk about that. So that would be it. And then second, Dr. Mins intimated that he did receive that every day. And he had the piece of paper printed out and was, in my opinion, pretty forceful in his belief that he received that every day to us just in our meeting last Wednesday. So if he's receiving it, is it coming to the county and then are we getting stonewalled by staff?
No, staff aren't stonewalling anybody. The information
Well,
that.
you remember, Tim, we weren't getting information about COVID clusters, and we had to bring the attorney in. So I want to know if we're not getting it, because Dr. Mins stood here in front of all of us, if we all remember, last week and said he gets this every day.
My understanding is that report is compiled on a weekly basis, and a staff person goes into EpiTrax and hand counts the numbers of hospitalizations that are reported to KDHE, which is, from my perspective, not the same as a daily count. I don't think that's available daily. I think it's based on a weekly count.
Okay. And
And I think that report that Dr. Mins had with him will now be made available to all of you commissioners as well.
that is wonderful to hear.
But
So-
again, I believe that's going to be a weekly rather than a daily.
And I don't think that report still gets us to where you want to get, which is that daily.
If it's unavailable, it's unavailable, and I can live with that, and we can pass that along to our constituents. But if it is available, like Dr. Mins intimated that it was available, I do believe we should have that, and that should be open records, and then we should be able to supply that to any interested parties. If it's not available, like I said, we will live with that, and staff's done a stellar job, I think, of getting us information once we've asked for it. But the public's also asking for it. I was tagged in a Facebook post yesterday from a constituent that wants to open a restaurant, but she's concerned about a few of these numbers. So I think if we can get that information and disseminate it, that'd be wonderful. But if we can't, like the manager said, I don't want to put our relationship with HCA or Ascension in turmoil and cause issues with them, because they're great community partners. So just get back with us whenever you can email us.
We'll do the best we can,
Not
sir.
a big deal. Y'all are great. Thank you.
And the other thing that I'd like to do for the community is point them to the website, because we have, since the beginning, we've added a tremendous amount of information on the website. And so the graph that's up right here, in addition to having Tom's assessment that the hospital status is good, we're also showing, in general, the number of admissions by week of admission here. And so that you can see that while it is somewhat steady now, it's less than it was 8 weeks ago.
Absolutely. It's comprehensive. It's great. This was the only piece that's missing off the website from any feedback I've received, hospitalizations. But as we all know, from day one, the whole purpose of any stay-at-home order was to flatten that curve, bend that curve, whatever adjective you want to use regarding the curves and hospitalizations. And so I think once that's been our, lexicon, we need to continue to harp on that if we can. So, thank you.
Okay. Commissioner Howell.
Thank you, Mr. Chairman. So, looking at the graph that you have up right now, if I was to interpret that, I would say we had 5 more admissions and 2 discharges in the last week, is what that's telling me. Is that about right?
Well, we've had 7 discharges, or we've had 7 admissions, and it would appear that we've had 2 discharges.
So if I was to try to keep track of an accumulated number, I would say we've had we've had an increase of about 5 in the last week.
If the discharge numbers were reported as vigorously and as accurately as the admissions numbers are. One of the things
So
that
I don't
we
want to read too
discovered-
much into that chart, is what you're telling me.
I think the thing that's important to look at on this chart is the blue bars, the dark blue bars, because those are the admissions, and those are reported, I think, very accurately by hospitals. And so that's the number that matters, I think, for the most part. The discharge number is not as reliable as
Well, I
admissions
partly
are.
agree with you. My concern is, what's our capability at the hospital? Again, I would like to quantify how many ICU beds we have, how many ventilators we have, how many hospital beds are available for COVID-19 patients. I know they don't want to release that information. I can kind of figure it out because the information is available on state website. And I know we have about 1/6 of the state's population here in Sedgwick County, so I can do some math and figure out about what we have here. Our numbers, in my opinion, are, in fact, actually really good. So I agree with the green check mark there. I would say, again, I heard through the grapevine, we actually had, if I understand correctly, I believe, a reduction of 2. Dr. Min stood here last Wednesday and said we had 17 in the hospital that day, and he produced a sheet. He gave me the copy. And he said as of that, the latest report that he had, there were 17 people in the hospitals, and he qualified that, said they were Sedgwick County residents only. And I'm fine with that. I don't need to have the details of which hospital. I don't need to know more details than that. That was actually really good information. And then, if I understand correctly, we've seen actually a reduction of 2, but I don't get that from this chart. I believe we're actually less hospitalizations today than we had last Wednesday. And so this chart's my opinion, is not telling me what I really want to know, and that is, what's our trend line in terms of how many people are in the hospital? Is it spiking and we should be alarmed, or is it basically, pretty even Steven type of thing? So I really think we ought to have more data on this. And by the way, Dr. Mintz did last Wednesday commit to providing that chart to us, and I have yet to receive any copy of that since he handed me the copy. And so I'm still would like to get that. I'll ask again. Back to Commissioner O'Donnell's point, I believe what he said was that the chart is updated every day, but that particular statistic or that number on that chart is only updated once a week. That's fine. As often as he gets it, I think we ought to have it. So I'll continue to ask for that. And
One thing, Commissioner Howell, on
Yes.
this chart, this is a weekly analysis, and the termination date on this particular graph is June 20. So even numbers we got yesterday or today are not going to be inclusive in this graph yet. That's also part of the flaw with this.
I understand, but whenever it is updated, though, it gives me some sense of what's happening. And I want that to be as accurate as possible. And so I know that this is the type of data that led to the article, I'm assuming, over the weekend from the Wichita Eagle, once again. They don't have the full picture because we don't have the full picture. And I just think that if everybody understood, okay, we actually, if I understand correctly, since yesterday, we had a reduction of 18 active cases according to this. This was actually updated yesterday afternoon. So the day before, compared to yesterday, we had a reduction of 18 active cases. That to me is very good news, and that's the kind of thing I think we ought to all be tracking. The total number of cases is interesting, but it's not useful. It's what we want to know is what's the trend line for active cases and hospitalizations, and that's the most important data. If we can't get that data reliably, then we can't make good policy. And I think that again, as often as it's updated, as long as it's accurate and gives us a complete picture, then it's very useful. And there's 2 things I'm watching specifically, and it's our active cases and our hospitalizations, and I don't have access to the hospitalization data. And that's the thing that really bothers me the most, because I think we continue to say we're trying to flatten the curve because of the medical establishment's capabilities. We don't want to overwhelm them. And so I'm really watching that number closely. And I've gotten a lot of concern, people concerned about these numbers because of the articles that came out. And my response to them is, I don't think that's a complete picture. And I think I'm being validated now that you're telling me it's not a complete picture. I need to have the rest of the data. If we can get it from Dr. Mins, or if Kate gets it when she updates this chart, whatever happens there, I need to get all of the data that's available. Thank you.
Commissioner Cruz.
Thank you, Kate. Thank you, Chairman. I guess the active cases in the hospital, our hospitalizations, I think those are snapshots of today, and we know this virus, really, what we do today affects us 2 weeks from now. And so that, to me, I think is very important to really consider. On the hospital call yesterday, we talked about the ancillary problems that people have when they contract this virus, as far as gastrointestinal problems, loss of smell, brain fog. Obviously, it's respiratory, but there are other factors that we really have to consider, which is why precautions are so important. Wearing a mask, doing those things, staying away from folks. One of the folks yesterday on the call mentioned that there were 2 cases that attributed to downtown activity in Old Town. It's important for us to understand that just because our hospitals aren't overrun doesn't mean that we don't have a virus that's active in our community that can cause real problems for those who contract it, even if they don't end up in the hospital. And for me, that's where I just want to make sure that we reiterate the fact that these precautions that we are taking are absolutely necessary. Those businesses that have shut down voluntarily for a temporary time, Mort's, Meddy's, Connie's, the Anchor, I don't even believe is still open yet. People are weary to go out, and we want to eliminate that. And the more we can talk about, like, when is our campaign? We talked about the $25,000 that we allocated, I don't know, 2-3 weeks ago, maybe even a month ago now. But we've talked about an advertising campaign. We've talked about, I guess the thing that I hear the most from folks is there are no absolute restrictions. It's only recommendations. People are very upset that we have not mandated restrictions. And I get that, and nobody wants to be under those, but we also want to keep our community healthy. And so what's the balance, and how are we going to get our communication message out there as much as possible? What is the plan for that? Because I've seen something, but I want to see more. I need more.
I'll have tomorrow on the 1st, July 1st, next time we have a meeting. We do not have one tomorrow. Tanya always will give us an update on communications regarding CARES expenditures, and we'll get fresh information for you. And since we don't have a meeting tomorrow, we'll make sure you get the most up-to-date information on what's going on with comms this week.
Okay, thank you.
Okay. Tim, I don't see any other questions, so appreciate the
Chairman,
updates.
while Tim's got the podium, hold on a second, Tim. Just
Okay.
on testing, real quickly, and Commissioner Cruz brought it up, and several of the rest of you have too. If you look at what's in our circle of influence regarding silver bullets out there for COVID, clearly a natural immunity, herd immunity, or a viral change would be miraculous, but possible. A vaccine, Dr. Mins told us last week, is months, maybe a year off. So the really only one we have any influence on is the testing component of this. And you will be inundated over the next 2 to 3 weeks with changing technologies of testing, all of which our staff is constantly monitoring and watching. Saliva testing and serological testing and faster tests. And what we look for is availability, reliability, cost effectiveness, and quickness. So we will all be, through the media and even through local efforts here, inundated with information on new testing technology. Anytime you hear of something that you want us to take a look at, just shoot us an email. We'll throw it on the list and look at it as a group. And then we have to be very cognizant, and we part of a discussion yesterday where we don't want to suffer from analysis and paralysis, that whole thing where you just constantly are looking for the right one and you end up doing nothing. We'll have to make a leap at some point here soon if we want to make an impact for the fall. So we're on this. We will take all the help we can get from you all or from any citizen that can help us with this shift. But I just think we'll see a lot of information. You commissioners will see a lot of information over the next 1 to 3 weeks from people, outsiders, and people even within our own community on different testing samples. So just want to make that final statement. So.
Okay. Commissioner Dennis.
Thank you, Mr. Chairman. Well, I appreciate the fact that we're looking at testing and different ways of doing the testing. That's something I've been pushing for all along. I believe that the testing is a critical component for us to make any logical decisions. I am still very interested, as you know, in the serology tests with the blood. I've heard some things about the saliva tests. I understand it's not just a quick saliva test, that you have to use sputum, but I don't know. I need more details on that, on how that test works. So I appreciate the fact that you're working on those issues. The other thing that I'd wish the state would do, I gave the manager a deal from Pennsylvania one time that it listed all the deaths and the underlying causes that each of those individuals had. I understand we can't do it because we've only got 25 deaths here. Now that's terrible to say that. I'm sorry. We've had 25 deaths, which is tragic, but it's not enough that we can not identify the people if we put the underlying causes with people with 25 deaths. But the state has 595, is that right? What we've got? No, I'm sorry. Do we have the states up there? Anyway, it's in the hundreds. If the state could show all of the underlying causes like the state of Pennsylvania does, because first of all, we need to protect those people more than anyone else. They're the ones that have underlying causes are the most susceptible to this disease. So we need to get that word out that if you've got underlying causes, you need to be even more cautious on wearing a mask and not going out. But the other side of that is that people with underlying causes, we need to know that how many people are dying of COVID, which have significant other health issues as we press through this. So that's one piece of information that I'd like to have. I'm sorry, Kansas has 259. Thank you. I don't know if 259 is enough that it won't identify those people or not, but I know we can't do it at a local level. Thank you, Mr. Chairman.
Okay.
That's all we had, sir.
All right. Is there any other comments? I don't see any. So are we coming to the close of staff meeting? Okay. All right, Tom, thank you. And thanks, staff, for the morning and all the information. Thank you, commissioners.